Dear conference session organizers, hello everyone. I'm Guo Jian from the Clinical Hospital of Chengdu Brain Science Institute, MOE Key Lab for Neuroinformation, University of Electronic Science and Technology of China. The title of my report is Factors Related to Social Disturbance Among Patients with Mental Disorders Caused by Amphetamine-Type. Topic, background and significance. Social support plays an important role in reducing violence and perpetration of the patients with psychiatric disorders. However, little research has examined perpetration of the patients with psychiatric disorders due to amphetamine-type stimulants and other influencing factors. This study explores whether clinical characteristics and social support scores are related to the occurrence of perpetration in patients with psychiatric disorders due to ATS. This study aims to lay the theoretical foundation for the design and development of an intervention tool for the relevant patients. Research ideas and methods. Methods. The participants were 105 patients at the Force People Hospital of Chengdu with ATS-induced psychiatric disorders. Each patient was identified as either a perpetrator or a non-perpetrator according to the Ministry of Health Office CDC 2009 number 104 on causing trouble. A perpetrator's behavior violates the Public Security Management Punishment Law, but not the criminal law, or violate the criminal law and create a criminal case. The Social Support Rating Scale, SSRS, was used to access the social support status of each patient. A higher score indicated a better social support status. Demographic and clinical characteristics data were also collected. Then univariate and multivariate logistic regression models were applied to examine the difference between the two groups. Research results and conclusion. Results. Compared with the non-perpetrators, the perpetrators had lower total social support scores, 24.1 plus minus 6.59 versus 28.94 plus minus 5.59. T is 3.364 and P less than 0.001. Objective support scores 5.5 plus minus 1.96 versus 8.2 plus minus 2.13. T is 5.183 and P is less than 0.001. And support utilization scores 4.6 plus minus 2.26 versus 6.28 plus minus 1.9, and the T is 3.435 and the P is 0.001. Furthermore, the multivariate logistic regression model demonstrated that the total social support scores OR is 0.873 and P is 0.018, whereas the risk factors for the occurrence of perpetration in patients with psychiatric disorders due to ATS. Conclusions. Social support is an important correlate of the occurrence of perpetration behaviors in patients with psychiatric disorders due to ATS. We found that among the patients with ATS-associated psychiatric disorders, those with less social support are more likely to be perpetrators. Results suggest that improving family-based and community-wide support for mental disorders patients due to ATS may reduce the occurrence of perpetration behaviors in them. Supported by Sichuan Science and Technology Program 2020 ZYD 013. Thank you.